Hello, this is Dr. Trivedi, a doctor working here at this clinic. May I confirm that I'm talking to Jim person, 35 years old?
Yes, Dr. It is.
Okay. How may I address you?
Please call me Jim.
Okay, Mr. Jim. Today we are going to discuss about your health issues. Is that all right?
Yes, doctor.
Okay. Mr. Jim, can you please tell me in your own words about your health problems?
For the last 1 year, doctor, I have felt recurrent dizziness spell about 3 times, 3 or 4 times over the year. And lastly, I thought that it might be something abnormal. Then I visited my GP. He found nothing abnormal. He ran some blood test and also some test called electrolytes, but all this came normal. So he thought that I need some further evaluation. He sent me here.
Okay. I will try my level best to find out what's troubling you. And may I ask you that in detail that what you mean by dizziness?
Doctor, sometimes I feel that I am going to fall down. And once episode, I also fell down and lost consciousness.
Okay. Uh, okay. And when did that happen?
That was about 1 week ago.
Okay. And can you please tell me that before that happened, your loss of consciousness, did you had any warning shots?
No,
Like
it started suddenly.
okay. And were you alone or were you accompanied by someone else at that moment?
I was playing football at that time.
Okay. And okay. And did did anyone notice how long did you had that episode? That loss of
About
consciousness?
2 minutes.
Okay. And after that loss of consciousness, did you feel all okay?
Yes, doctor.
Okay. And did anybody notice who were surrounding you? Any change in color of you?
There might be. They said I
Okay.
got pallor at that time.
Okay. And may I ask you that before that happened while playing football, did you have had any chest pain?
No,
Any shortness of breath?
no.
Any racing and pacing of your heart?
During that episode, I suddenly felt my racing and pacing of the heart, and after that, I lost consciousness. I fell down and lost consciousness.
Okay. You fell down. And may I ask that did you had any injury?
No.
That fall? Okay. And okay. And is this okay? And let me ask you that is this episode different from the previous ones that you had in the last
Yes,
three
doctor.
or
I
four
never,
times?
I never lost consciousness before.
Okay. And what happened in those times? In those 3 or 4 times, did you just feel to fall down,
I
or
just I just suddenly felt that I am going to fall down, and at the time I felt that I am suffering from racing and pacing of my heart, and that persisted for
okay.
about a few minutes, about 3 to 5 minutes, and after that it went on its own.
And at the time, did you feel any sweating?
No,
Okay. Any hunger?
no,
Okay. Any? Do you have any? Feel any? May I ask you some other questions now? That do you have any headache?
no,
Okay. Any vision changes?
no,
Any weakness in any parts of your body specific?
no,
Okay. Any neck pain?
no,
Okay. And any noisy chest or chest tightness?
no,
Okay. Any changes in your weight?
no,
Okay. Any weather preferences?
no,
Okay. Any change? Any difficulties with your water work or any change in your water work?
no.
The color frequency, everything is all right.
Yes,
Okay. What about your bowel motion? Is that all right?
yes, doctor.
Okay. Let me ask you something more in details about your. Do you have know of any known history in your family? Sorry, in yourself, no known
No,
previous history,
I was
medical
quite
history.
fine.
Okay. Any history of high blood pressure or high blood cholesterol level, anything like that?
No,
Okay. And do you may I ask you that do you take any medication?
no,
Okay. Any over the counter medication?
no,
Okay. May I ask you something very personal question that do you take any recreational medication?
no.
Okay. And may I ask you that do you have any history in your family of heart diseases?
Yes, doctor. My father had some heart disease. They called it something obstructive heart disease. And also my elder brother had heart disease. He died recently.
Okay. And well, okay, that's all. I'm very sorry to hear that. When did they die? When did your brother die? At which age? Which age? Can you please tell me?
At 45.
Okay. And okay. And may I know that did you yourself undergo any investigation
No.
for heart? Okay. Okay. That's all right. May I know examine the patient?
Yes.
Okay. At first, I would like to expose the patient. Okay. By unbuttoning his shirt, and then I would like to. At first, I would like to outstretch his hand and outstretch the fingers to see any flapping tumor present or not.
No.
Then I would go for the pulse.
Rate is regular.
Regular. Okay. Then I would like to examine the precordium, whether any thrill present or not.
No thrill.
Okay. Okay. What about the apex bit? Any double impulse or not?
Yes.
Okay. And then I would like to auscultate the precordium.
Okay.
Any pancystolic murmur of MR is present or not?
Yes.
Okay. And does it go to the apex and then to the axilla?
Not going to the axilla.
Okay, but in the mitral area?
Yes.
Okay. And then I would like to check his sorry, I would like to check his mouth, oral cavity. Is there any abnormality present or not?
To estimate what type of abnormality you suspect.
Sorry, any problem in palate?
No.
Okay, and then I would like to measure his BP. Observation chart.
Yes, BP is 120 over 80.
Okay, and I would like to have a look at the blood glucose level.
5.3 millimole per liter.
Okay, and I would also like to check his jerks.
Okay.
Knee jerks and ankle jerk, and also plantar.
Okay, no need. Proceed.
And you told that no palate is not highly arched. Is that all right?
Yes.
Okay, and I would like to check the surroundings. Is there is any wheelchair present or not?
No.
Okay, and now I would like to may I ask you some personal questions? Is it okay?
Okay.
Okay, do you smoke?
Yes.
How many sticks for how long?
About 10 sticks per day for last 20 years.
Okay, actually smoking can is very harmful. It would be better if you quit, and if you like, we can refer you to smoking cessation clinic. Is that all right?
Okay.
Do you drink alcohol?
No.
Okay, may I know what you do for a living?
School teacher.
Okay, and may I know that do you drive?
Yes, time up.
Okay, okay. So I should not continue. Should I?
No. Stop.
Okay. Mhm.
So, did you come to a diagnosis?
Yes, as long as I've taken history, that I think that and examined the patient, I think that he is suffering from a condition named hypertrophic obstructive cardiomyopathy.
Do you have any other differential diagnosis?
Yes, he can also suffer from other familial conditions as well, like long QT syndrome, Brugada syndrome, WPW syndrome, arrhythmogenic right ventricular hypertrophy, etc.
Okay. Can it be epilepsy?
Sorry.
Can it be a case of epilepsy?
Well, it can be, but since he doesn't have any warning shots and the duration was very small, recovery period was also quick. So I think that it's unlikely. However, I should have asked some more questions about whether there is any tongue biting, or any shakiness, and any cloth disturbance in the wetting of his clothes.
Okay. So, what is your what is your diagnosis in a summary?
Summary: I think this 35 years old male has been suffering from recurrent dizziness in the last 3-4 years, with one episode of loss of consciousness. preceded by racing and pacing of his heart.
Actually, this was for 1 year, and it was a cardiac syncope, most likely due to hypertrophic obstructive cardiomyopathy. Okay, I would like to
Yeah,
investigate.
yeah, yeah. First of all, I would like to do some routine blood tests, then routine blood tests, including CBC, complete blood count with ESR and CRP to rule out any inflammatory conditions and to rule out any anemia or neutrophilia present or not. I would like to go for ECG if needed, 24-hour Holter monitoring. Then I will also go for echocardiogram, where I might look for some abnormalities like mitral regurgitation, and then also asymmetric septal hypertrophy and systolic anterior motion of the mitral valve as well. And I might go for genetic counseling and might also do genetic testing for the patient.
Do you think chest X-ray can be done?
Sorry.
Chest X-ray.
Yeah, of course. I just missed it.
How will
Of
you
course,
manage it?
yeah, urine RMA creatinine. I will manage. First of all, I will have to patient education and counseling. It's very important part here. I will have to educate the patient about the disease and its progression and its in successive generation its progression, and I might also counsel the patient and also might have to counsel him for genetic testing, and then I will involve the cardiologists to have to check him, and then we might have to go for a specific treatment. It might be drug treatment, it might be some surgical like alcoholic ablation or septal ablation, and for some drug treatment, some medication, and also
Can you name some medication?
yeah, I think I think amiodarone, beta blocker, calcium channel blocker, digoxin. This can be used. These 4 drugs can be used, I think.
Disopyramidine.
Yeah, disopyramide that can also be used. And
what are the complications of this condition?
Complications, I think breathlessness, syncope, and sudden cardiac death. This can be the complications.
It's arrhythmia.
Arrhythmia, dyspnea, angina, sudden cardiac death,
Stroke.
syncope. Syncope, stroke. Yes, stroke can also be a possibility.
Okay. Thank you.
Okay.
So first of all, you went very well, but you haven't managed time to meet his concern. Without asking him the personal question, you should have go for his concern, and after that, if you had time, you could go for.
Yeah, that's a technique actually. That's what I've learned in this case. I will later on. I will on the next case. I will do that.
Okay, and there was something that this was a very urgent condition and patient needed urgent referral to cardiologist. Okay, because patient has history of unconsciousness, that is cardiac syncope. This should be treated urgently. Okay, we are going for the next case. Ready?
Okay. No, 1 minute. I have a phone call. I just have to 1 minute. Okay. And I think admission is also needed here.
Yes. Or is monitoring.
Okay, you can you just stop the recording once? I've just had. Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm that I'm talking to David St. Pierre, 38 years?
Yes, Dr. It is.
Okay, how may I address you?
Please call me David.
Okay, Mr. David, today we are going to discuss about your health issues. Is that all right?
Yes, doctor.
Okay, Mr. David, can you please tell me that what have brought you here today?
For last few of months, doctor, I am noticing diarrhea, and I thought it was due to my work stress, and you know that I am an actor and I had to work a lot, and sometimes I had to travel a lot also, and I am having this problem. First, I thought that it was due to my work stress, but this problem is increasing, and in the meantime, I visited my GP. He gave me some medication called he called it some loperamide tablets, but that didn't help me, and I think my condition is getting worse. So I visited him again, and after that he ran some blood test, and he said that there are some abnormality in the blood test, so he sent me here.
Yes. Okay. We will try my level best to. I will try my level best to find out. Did you do you remember that did this bowel movement, changes bowel motion, come along suddenly or gradually?
Okay, actually, doctor, this started about 8 months ago, and I think it started somewhat suddenly.
Oh, okay. And how many times do you have to open up your bowel?
Initially, I needed to about 2 times a day, and after that, it progressed. Now a day, I have to open up my bowel about 3 or 4 times.
Okay. And okay. And is there any okay? And do you feel that how is the bowel motion? How is the color? If it can, have you noticed? Is it
Um,
normal or consistent?
Doctor, I also noticed a blood for a few times.
Okay. Okay. And may I know that is it fresh blood or mixed blood?
I think mixed.
Okay. And do you feel any pain while doing your bowel motion?
Not during bowel motion, but sometimes I feel pain in my tummy.
Okay. Can you please tell me where in the tummy do you feel this pain?
All over my tummy, especially around the umbilicus.
Okay. And do you feel that when you pass your bowel, this pain increases or decreases or anything like that?
Somewhat decreases.
Okay. And have you ever noticed any mucus in your bowel motion?
A lot.
Sorry.
A lot.
Okay. And have you ever noticed anything that makes you feel better?
No.
Okay. Any relation with your food? Have you noticed any?
No.
Okay. And any relation with any other thing? Have you noticed?
No, doctor.
Okay. And okay. And you told that okay. And did you ever feel any yellowish discoloration of your body?
No.
Okay. And any bloody vomiting?
No.
Any nausea?
No.
Okay. Have you noticed any? May I ask you some other questions? So, do you have any headache?
No.
Okay. Any changes in vision in red eyes or anything like that?
I had red eyes 2 times, were this time, and that lasted for about 3 or 4 days, and it went on its own.
Okay. And you didn't take any medical attention for it?
No, I just used black spectacles.
Okay. Okay. And any oral sore?
No.
Okay. May I ask you some other questions? Do you have any loss of weight?
Yes, doctor. I lost weight about 5 kg over this time. I don't know if it is related to stress or not.
Okay. Is it intentional or unintentional?
Unintentional.
Yes. And any fever, raised temperature?
Sometimes I feel fever.
Okay. And okay. And any racing and pacing of your heart or any
No.
sweating?
No.
Okay. Any changes in your water work?
No.
Okay. Any weakness in any parts of your body?
No.
Okay. And okay. And may I ask you some other questions? That do you have any known history any of diseases
No.
or any medication that you take?
Just loperamide.
Okay. And you told that you and any history, family history of any cancer or anything like that?
No.
Any other significant family history that you can mention?
No.
Okay. And you tell that you travel frequently. May I ask you that when did you last travel to any other country or something like that?
Not country.
Sorry.
I didn't went out of my country about for about 2 years.
Okay. Okay. That's all right. May I examine the patient now?
Okay.
Okay. I would like to at first expose him, and then I would like to examine the tummy. Any superficial tenderness present or not?
Very mild tenderness.
Okay. Any lump in anywhere, any parts in the tummy?
No.
Okay. And any palpable liver or spleen?
Okay, you cannot do that so fast.
Okay. And I would like to have to check anemia.
Mildly anemic.
Okay, any red eyes present or not?
No.
Okay, and then any oral sore?
No.
Okay, any joint pain present or not?
Remaining.
Any joint pain present or not in the hands?
Okay, doctor. I had some joint pain.
Okay, for how long?
For about 4 months.
Okay, and do you feel that is there anything specific that makes it worse or better?
I feel worse in the morning.
Okay, and is there any redness or swelling in your
No.
hands? Okay, okay, and okay, and now I would like to just examine the joints, hand joints. Is there any tenderness present or not?
No.
Okay, okay, and okay. Well, may I know what your concern is?
Why am I having this, doctor? Is it a cancer?
Okay, as long as I have taken history and examined you, I think that I cannot be totally sure at this moment, but I think that you might be suffering from a condition named inflammatory bowel disease. Have you ever learned of it, heard of it?
No.
Well, please don't bother about the term. It's a condition in which there is some inflammation in your bowel, and actually your condition, your symptoms might fit with this disease. Although we will involve the bowel doctor and other consultants and our consultant as well. We might run some blood tests to rule out any infection present or not, and we might also do some scanning tests as well. And after that, we will after confirming it, we can come to you with a better management plan. Okay, and may at this moment may I ask you some other questions, some personal questions. Is that okay?
Okay.
Do you smoke?
Yes, doctor.
How many cigarettes sticks for how long?
About 10 sticks for last 15 years.
Okay, smoking is very harmful, and it would be better if you stop it. If wanted, if you want, I can refer you to smoking
Time
cessation
off.
clinic. All right. Okay. Hmm.
So have you came to your diagnosis?
Uh, I think that the patient is um, suffering from inflammatory bowel disease, most likely ulcerative colitis.
Okay. I will investigate him.
First of all, I would like to do complete blood count with ESR and CBC. Sorry, with ESR and CRP to rule out any uh, inflammatory condition. For CBC, I might found neutrophilia and anemia, and ESR and CRP may be raised. And I would like to do stool routine microscopic examination to rule out any infective cause and also any ova or parasites or anything like that. And then afterwards, I would like to do some specific tests like plain X-ray, abdomen, erect posture, epiview, and also I have to do some specific scanning tests like flexible sigmoidoscopy or colonoscopy in line with the consultation of the gastroenterologist. And I also have to run the liver function test like including serum bilirubin, ALP, ALT, AST, prothrombin time, and if indicated, I might also have to do MRCP to rule out any primary sclerosing cholangitis that is present or not.
That is true. What? Okay. Do you like to do any plain X-ray abdomen?
Yeah, I told you, plain X-ray abdomen, erect posture, APV.
What do you suspect in this?
Yeah. I think in this case, I might find loss of obstructions and a lead pipe appearance of the bowel, and I think this can be important. If there is any complication, severe complication, I think I might find a toxic megacolon. The megacolon can be found, I think.
Okay, fine. And also, is there any test that in the stool that can differentiate between IBD and IBS?
Yeah. There is one. I just forgot to tell about it. There is actually one specific test in the feces, fecal calprotectin. It usually differentiates between inflammatory and non-inflammatory cause. Okay.
Okay. So how
Okay.
will you manage him?
So at first, I will have to do some patient education and counseling, and then I will have to start specific treatment. And the treatment might include induction phase, induction, then maintenance, remission, induction, remission, maintenance. I think, and consolidation. Sorry, consolidation and maintenance phase. For induction, I might go for sulfasalazine and those drugs. and also glucocorticoids. And then for induction, we also might go for Saladin, glucocorticoids, and
Are you
something like
going
that.
to treat him yourself?
No. In line with the patient education counseling, and then I will have to form a multidisciplinary team, including including medicine specialist and or gastroenterologist, and then I will have to go for a specific treatment, which might include induction, remission, remission, induction, maintenance, and consolidation.
Do you think ophthalmologist opinion should be taken?
Yes, sorry. Eye specialist, ophthalmologist, and rheumatologist can also be consulted to find out whether there is any
And does this
IBD.
patient need admission or not?
Uh, at this moment, um, I think the patient needs admission. I'm not sure.
What is the admission criteria?
Well, actually, I don't think. Sorry, I don't think the patient needs admission because for severe ulcerative colitis, usually bowel have to open up for greater than 6 times, and there may be present bloody diarrhea, anemia may be present, hypoalbuminemia. I am not sure about this at this moment, so I'm not sure because he is opening a bowel for 3 to 4 times at this moment. So it might not be necessary for to admit him at this moment. I'm not sure, although, but I don't think.
And this patient was taking loperamide. Do you think any advice should be given on that medication?
Yes, I think loperamide should be stopped in this patient.
Okay. Fine, thank you. Okay, for this gentleman, for history taking of his study, were a little bit haphazard today. I don't know why.
Yeah.
That is, we know the site, then onset, when it started, how it started, is it on frequency, and after the frequency, then consistency of the stool, color of the stool. You went for that. Okay, and there is no radiation. So and other associated symptoms with bowel problem for GIT, you should have asked about any abdominal pain, lumps or bumps, nausea, vomiting, weight loss, any bloody vomiting.
I asked those, but I was a bit haphazard actually.
Yeah, and after the completing the GIT symptoms, the involvement other symptoms like iritis, if you suspect
Mhm.
iritis, pallor, jaundice, then thyroid issue, then
Mm.
any shortness of breath, then any joint pain, rash.
Mm.
Okay,
Mm.
and after that, red flag symptoms is along with these red flag symptoms like weight loss.
Yeah,
Okay,
nighttime diarrhea.
after that, timing is at nighttime bowel pass or
Nighttime.
not. Any eliciting or aggravating factors, any specific food habit or any stress or
Mm.
anything else that makes it worse or anything that makes
Mhm.
it better, then severity. How is it affecting your life? This person
Mm.
is an actor, so it is affecting his life.
Yeah.
Okay, and
I
first,
can just manage time. I'm so haphazard.
you are haphazard, so you couldn't manage time.
Yeah.
First,
Yeah.
his first history was fine. Drug history was fine. Family history was fine. You haven't taken the personal history. That was very important because patient is a smoker.
Mm.
Okay, have you asked about personal history? I cannot remember.
No, I couldn't get time.
Okay, smoking, then dietary habit, if any dietary changes, and alcohol.
Mhm.
And after that, for asking about for admission criteria, I should they should have a few things that you should have asked about the pulse, the blood pressure, if there is any pulse. And in the admission criteria, there are not only the bowel frequency of bowel, there are
Yeah.
other factors
Yeah, I know. I
which
have
pulse.
forgotten.
And this patient also said that he is facing the raised temperature. So you should have measured the pulse, blood pressure, temperature.
Mm.
full abdomen examination, and without this, I cannot sure that if you can say patient need admission or not. You haven't asked those even.
Yeah, yeah, that was very important. I just, yeah.
You should have asked at least that I need to assess those, and after that
Observation-
I can tell that if you
At
need.
least observation chart.
Yeah.
I think if I
This
at
patient
least
was
if I
this was an outpatient basis, so observation chart you will not find observation chart, but you should have asked during the examination that I am going to ask do this so that I can say
yeah, yeah, yeah.
my tenderness.
Mm.
Okay, should we go for the next case?
Oh,
Okay.
okay.
In the maintaining the patient's welfare, education and counseling the patient, and involvement of the multidisciplinary team, and other than before that, you should have told that this patient needs admission or not. At least you could say that I will assess for this patient is admission or not by assessing his pulse, blood pressure, temperature, and full abdominal, full CIT examination. Okay, and after that, multidisciplinary team involvement, and this patient also acute exertion may need steroid. Okay, so this may need a steroid. We counsel for that. This patient may need steroid, and after that, other factors like you should have stopped the loperamide until we are sure about the condition, until we give next advice.
Okay. Okay. Okay.
Okay, we're going for the next case.
Just give me 1 minute break. Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm that I'm talking to Kerry Nupe, 38 years old?
Yes, doctor.
Okay. How may I address you?
Please call me Kerry.
Okay, Ms. Kerry. Today we're going to discuss about health issues. Is that all right?
Okay, doctor.
Okay, and during our discussion, can you please tell me in your own words what have brought you here today?
Doctor, for last couple of months, I noticed that I am having some pain on my hands and on my both hands, mostly on my left hand. And I don't know why I am having this. And this is a totally new thing.
Okay.
After that, I visited my GP. He gave me some painkillers medication, ibuprofen, but that isn't helping me.
Okay. Okay. And may I know that does it involve still only the left hand or the right hand? Or
Both hands, but more on the left side. Hello?
okay. May I know that does it involve only the left hand or the right hand also?
Both hands, but more on the left side.
Okay. Okay. May I ask you that did it come along suddenly or gradually?
Gradually, doctor.
Gradually. Okay. Whole of the left hand or only part of left hand?
Part of left hand, especially around my thumb.
Okay. And okay. And may I ask you that do you feel any how would you like to describe the pain?
Something like some funny sensation, some tingling sensation.
Okay. And may I know that how frequent is it now? Is it present all the time or any specific timing?
Not all the time, but sometimes, especially it is more at night.
Okay. Okay. And do you ever have to get up at night due to this pain?
Yes, doctor.
Okay. And is there anything special that makes you feel better or worse?
Doctor, I need to shake my hands, and that makes me somewhat feel better.
Okay. And does this pain radiate to anywhere, go to anywhere else, or just in the hand?
Just in the hand.
Okay. Now let me ask you some other questions. Do you have any changes in your weight recently?
No,
Okay. Any weather preferences?
not recently. I had previous weather preferences, especially I liked the hot weather. And after taking medication for last 1 month, I am feeling somewhat better.
Okay. If you don't mind, may I ask you that when were you diagnosed for this?
1 month ago.
Okay, and you are taking medication for since this 1 month.
Yes, doctor.
Okay, and okay, and may I ask you that has there been any recent changes in your medication dose?
No.
Okay, and may I ask you that uh, uh, okay, and how about your bowel movement?
I think it's fine.
Okay, and okay, and and may I ask you? It's a personal question. May I ask you about it?
Okay, doctor.
May I ask you that how about your menses?
I haven't seen any problem with the doctor.
Okay, and may I ask you that have you ever measured your blood pressure and is that all right or anything like that?
Yes, doctor, it's all right.
Okay, and may I ask you some other questions now? Do you have any headache?
No.
Any rashes anywhere in your body?
No.
Any changes in your vision?
No.
Any joint pain?
No.
Okay, and may I again? Okay, and may I ask you some other questions now? That do you have any known medical history, disease history?
Doctor, 1 month ago I was diagnosed with underactive thyroid, and I am
Okay,
taking thyroxine for that.
okay. Any other medical condition that you know?
No.
Any other drugs, medication that you take other than apart from thyroxine?
No.
Okay. And do you have any history in your family, any of thyroid issues or any other thing?
No.
Okay. And may I now examine the patient?
Okay.
First of all, I would like to examine the hand, rest the hand on on a pillow, and then I would like to do the patient both prayer sign and reverse prayer sign. Is there any pain generated or not?
Yes, there is a tingling sensation over the lateral aspect of hand.
Okay, and now I would like to again roll over the hand, and I will tell the patient that I would like to gently tap the hand. Okay, in the through the thumb in the lateral part. Any pain reproducing?
Yes, that's tingling
Okay.
position.
Now what I have to, okay, I would like to make an O sign with index finger and thumb in both hands. Not
Yes.
let me open it.
Yes.
Okay. Yes. Can you open it?
Yes.
Okay. And then press against my hand to see the radial nerve function. Press up against my hand.
Yes, she can do that.
Okay, and then don't let me press your fingers to see the ulnar nerve function.
Intact.
Okay, and compress my finger within your two fingers.
Intact.
Okay, and then I would like to have a look at the thyroid function by taking. Can you please take a sip of water?
Okay.
Okay, and I would like to feel the gland, whether any nodularity or not, or any pain or not.
Mildly diffused in rest.
Okay, and now I would like to look any lead lag or lead retraction present or not.
No.
Okay, and I just forgot to add one thing. When I checked hand, I would like to see whether there is tremor present or not.
No.
Okay, and may I know what your concern is?
Why I am having this pain, doctor?
Okay, as long as I've taken history and examined you, I think that you might be suffering from a condition named carpal tunnel syndrome. Have you ever heard of it?
No.
Okay, don't
Domestically.
bother about the don't bother about the term. Actually, it's a condition in which one of the nerves that supply your control your hand function can get compressed. Okay, and it might be the cause that you are suffering from this pain. There might be several causes behind it. One cause might be that you are suffering from a condition named your thyroid. This can be a cause of it. However, there can be other causes behind it also as well. At this point, may I ask you some personal questions?
Okay.
Have you noticed any gain of your weight recently?
No.
Okay. And may I ask you some personal questions now? Do you smoke?
Yes.
How many sticks for how long?
10 sticks for about 15 years.
Okay. Smoking is very harmful, and I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Is that all right?
Okay.
And may I know what you do for a living?
I'm a housewife.
Okay. And is this pain affecting your jobs, household jobs?
Yes, doctor. I cannot clean my
Okay.
houses
Okay. I can get it.
clearly.
Yes. Yes. I can get it, and I can involve the social services in this case. Okay, so that they can help you more in this case. Okay, are you getting me?
Okay.
Okay, and any more concerns?
Do I need any surgery for it?
Okay, actually, at first we will have to give you some medication. At first, I will have to consult with our specialist, and then we will give you some medication apart from at the same time of doing some tests. Okay, this medication might be steroid, and if it does not, if it's not under control, then we can also give you some sprints and advise you to take rest. Okay, and after doing all these things, if we to see that you
Hang
are
on.
okay.
So have you came to diagnosis?
I think that the patient is suffering from carpal tunnel syndrome, most probably due to hypothyroidism.
What would be the other causes for carpal tunnel syndrome?
The other causes can be obesity, pregnancy, rheumatoid arthritis, hypothyroidism. These are the causes, I think.
Okay. How do you investigate her?
I think carpal tunnel syndrome is larger clinical diagnosis. Although we have to do some nerve conduction study and electromyography in this patient, and we also have to do some blood tests, some routine blood tests like a complete blood count to see any neutrophilia or any anemia, to see about the neutrophil and lymphocyte counts, and also ESR and CRP to find out any inflammatory conditions present or not, and then the thyroid function test including TSH, T4, and T3 levels, and also might have to do some thyroid autoantibody testing, including anti-TSH receptor antibodies and thyroid and other antibodies, and we might also go for anti-CCP testing and rheumatoid factor testing, and uh, I think and also serum urea, creatinine, and electrolytes level.
How will you manage that?
Patient education and counseling, then forming a multidisciplinary team involving medicine specialists, physiotherapists, social services, and occupational health services. Although occupational health services might not be needed here, and then I will go for specific treatment, which may include surgery, steroid tablets, splints, and if not controlled, then might be that carpal tunnel release through surgical decompression, and also the treatment of the cause of it, which is most likely to be hypothyroidism in this patient.
Okay. So you are asking you are asking the investigations like thyroid antibody. This patient is already diagnosed with thyroid hypothyroidism. So do you think this twist would bring any good for you?
No, I was wrong.
And do you think that this patient should be prescribed with steroid for his carpal tunnel syndrome?
I'm not sure about it.
Okay.
Can you please tell me more?
No, no steroid. Steroid itself is a water fluid accumulating condition.
Uh, so I just forgot the treatment. Can you please tell me?
Just physiotherapy, then some painkillers, medication, and some splint, specific splint, and then involvement by the rheumatologist if there is any need for surgical referral or not.
Okay. Okay. Anything more to discuss?
Yes, and causes, most of the cases are idiopathic. Other than those, there are causes like pregnancy,
Mm,
then hypothyroidism, then
mm,
rheumatological condition, then
mm,
other condition amyloidosis, then
mm,
kidney uh, uh, dialysis patient or
yeah.
yes, renal failure or dialysis, especially on the peritoneal dialysis patient.
Okay. Mhm.
Mononeuritis multiplex, that is also another cause.
Sorry.
Mononeuritis multiplex.
Yes. So many causes. Okay. Another thing. Hello.
Yes.
Another thing that there were some other causes of hand pain. I think like hypocalcemia, then Raynaud's or something more. Can you just tell? This is like this is not. I'm not telling about carpal tunnel syndrome. Some other causes of hand pain. I think.
Yes. For parts you have asked about the side, then onset, then criteria. In the criteria, patient will tell you that what is this, what is her feeling, and that
Mm,
will be sure that what she is meaning. For
mm,
rheumatological conditions, there will be joint pain. For
mm,
Raynaud's, there will be pain at the fingertip. For
mm,
hypothyroidism, there will
mm,
be pain all over the hand, and for carpal tunnel syndrome, there will
mm.
be pain over the lateral aspect of the hand.
Yeah. Raynaud's tip.
Raynaud's tip,
Mm,
rheumatological over the joint.
mm, mm, mm. Okay. And I think found a case of hypocalcemia. It was over all the hand, I guess, due to.
Yes, the patients was all over, pain was all over the hand, and also patients had experienced rather some funny sensation
Mm,
rather than pain.
yeah, and also I think some arterial diseases can also be thought of. Any large vessel arterial diseases, Takayasu or something like that.
Okay, Takaisu, I think they come with does they come present with pain? I don't know.
I don't know. Well, I am just coming about the DDs actually. Hypercalcemia can be a DD, Raynaud's can be a DD. Okay, apart from CTS, what other DDs can be present?
Then traumatic, you haven't asked about any history of trauma before the onset of this pain.
Mm, mm. Another trauma. Any other thing? Can you remember?
No, for associated, you haven't asked about the rheumatological condition. Sorry, Raynaud's phenomena. Any changes in
Yes,
the tip of the finger.
yes, I must have asked. Okay, okay.
Okay, fine. Thank
So,
you.
okay.